ligaments. The main ligaments which are going to give stability to the temporomandibular joints are temporomandibular ligament. This is the number one ligament, temporomandibular ligament. And second ligament, it is the stylomandibular ligament. Stylomandibular ligament. Third ligament is the sphenomandibular ligament. Sphenomandibular ligament. So temporomandibular ligament, stylomandibular ligament, and sphenomandibular ligament. First we will see what is this temporomandibular ligament. By name itself we can understand that the ligament is going to present between the temporal bone and mandible bone, So here the temporomandibular ligament is the strongest ligament in the temporomandibular joint, and it will be having two fibers. It will be having two fibers or portions. First portion is the oblique portion. Second one is the horizontal portion. So here the oblique portion is nothing but the outer portion. Of the ligament. Horizontal portion is nothing but the inner portion of the ligament. Now we'll see where it is going to present. If we see the outer portion of the ligament, is going to between it. Outer oblique portion of the ligament attaches from the neck of the mandibular condyle to the articular eminence. This is outer oblique ligament. Outer oblique fibers or ligament or portion of the temporomandibular joint. This portion is going to resist the downward movement, and at the same time posterior movement. Downward movement and posterior movements. Downward posterior movements are restricted by this oblique orientation of the outer temporomandibular ligament. And one more, it is also helpful for this ligament is also helpful for the limiting the rotation of mandible while mouth opening. When we are opening mouth, the rotation movement will happening at the condyle of the mandible. So the presence of this ligament is going to limit the more rotation of the mandible condyle over the articular eminence. So this is about the outer portion, oblique portion. Now if we see horizontal portion, that is inner portion. The inner portion of the ligament is attached to the lateral pole of the condyle. See, this is lateral pole of the condyle. At the same time, here we will be having disc. So the posterior portion of the disc, lateral pole of the condyle, posterior portion of the disc, and at the same time articular eminence. Here we will be having articular eminence. So here the fibers of this temporomandibular ligament is the horizontal orientation. So it is the inner ligament. So what is the use of this ligament is these fibers are almost horizontal. These are going to give protection, resist the posterior movement of the condyle of the mandible. The presence of this horizontal ligament is going to limit the posterior movement of the mandible. When it is going to do this limitation, automatically if the posterior movement of the mandible is limited by one ligament or any muscle. So what is the point here means the retrodiscal pad will be under protection. What is this retrodiscal pad? Already we discussed. Now we will come to the second ligament, that is stylomandibular ligament. The stylomandibular ligament, it is like a thin ligament. It is very thin ligament, and especially this is not a true ligament. It is nothing but the stylomandibular ligament. It is a band of deep cervical fascia. So the ligament where it will be present, it is present between this is our temporal bone. This is the styloid process of the temporal bone. The ligament is present between the styloid process of the temporal bone to the posterior to the rami of mandible. This is rami of mandible. This is body of mandible. So the stylomandibular ligament is going to present between the styloid process of the temporal bone to the posterior to the rami of the mandible. And what is the function of this ligament is, it is like a little controversy. Some authors will say that it is going to prevent or limit the protrusion movement. Protrusion movement is nothing but if our jaw is there, okay, if the jaw is moving forward, that is protrusion. Protrusion means simply if this is upper jaw, this is lower jaw. If the lower jaw is moving forward, if the lower jaw is moving forward, this is protrusion movement. The protrusion movement is limited or prevented, okay, limited or restricted by this stylomandibular ligament. Some authors will say that there is no function for this ligament. So this is about the stylomandibular ligament. And now third, the last ligament, sphenomandibular ligament. It's very easy to understand. Sphenomandibular ligament. So here we'll be having Here we will be having the bone that is called sphenoid bone. Sphenoid bone. So the ligament will come from the sphenoid bone to the middle of the rami of mandible. Middle of the rami of mandible. So the ligament will be situated here. So what is the function of this ligament? Some authors will suggest it is going to prevent the forward movement. Otherwise, it is going to restrict the more forward movement of the mandible. And some authors will suggest that it is going to restrict the more downward movement of the mandible. And some special authors, they were saying that there is no function for this ligament. So this is about the ligaments of the temporomandibular joint. Main ligament, temporomandibular ligament in this oblique and horizontal, and stylomandibular, sphenomandibular ligaments. Clear?